Maria Holder Diabetes Center.
Half of people living with diabetes don't even know it. Get screened, know your numbers.
It's a go! It is kickoff time for 15 diabetic-friendly foot minutes on VOB 92.9 FM, all with the compliments of the Barbados Diabetes Foundation. So what about the foot will you be talking about today? We direct that foot question to Dr. Diane Brathwaite.
So we're going to think about the skin, the nails, and the footwear itself.
All these aspects of the foot will be discussed today, all with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that can kickstart your dreams into a financial reality. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
Happy Saturday morning, VOBers! This is Peter Boyce here to kick off this Saturday show by reminding you how you can score health goals and be a winner by visiting the Maria Holder Diabetes Center located in Warren St. Michael right behind Eunice Gibson Polyclinic. Whether it's getting your ice cream for diabetic retinopathy, that is something that you should be doing every single year once you are diabetic, or getting a vascular screening just to check to make sure you don't have what people call bad circulation. You can also make an appointment to see dietitian Victoria Cox, because you might be there saying, I would like to lose weight but I don't know what to eat, I would like to be healthy. What can I do? Make an appointment with dietitian Victoria Cox to help you achieve your health eating goals, because you know sometimes you could be eating something for years thinking it's good for you and then find out it isn't. With that in mind, take a listen to this next segment. It's Medical Mythbusters! You feel it, so?
Somebody tell me.
That's what they say.
Oh, you see it on the internet?
But what really is the real truth, though? This is Medical Mythbusters with GM Marshall White. The truth is here. Hey, Alfonso! Yeah, you catch it again? What's that you blinding? Oh yeah, but not a healthy smoothie. Yeah, you probably very nice sweetener in that drink. Mildred, this honey, you know, this is 100% natural sugar. This ain't like regular sugar. Let me hear a Jim of the Maria Holder Diabetes Center Marshall say about this.
So this is a big one because people always say that it's natural sugar. Natural sugars, all kinds of natural sugars, honey, agave, coconut sugar, maple syrup, they raise blood glucose levels just like regular sugar because the body processes all forms of sugar similarly. Regardless of how natural they are, your body cannot tell where they came from. They all break down into glucose.
Thank you, Marcia, for that healthy honey tip. So VOB people, be careful how you use honey here and make an appointment with dietitian Victoria for your own personalized meal plan. As we now move on to our featured medical presentation for the morning, and it's from Dr. Diane Brathwaite. Good morning, Dr. D.
Hello, good morning. Welcome to another Saturday show with us from the Barbados Diabetes Foundation. This is Dr. B here. I hope you had a wonderful week. I hope
that you're able to balance the challenges of the week and at the same time do your best to wake up each morning with gratitude. Now, we've spent a lot of time over the last few weeks talking about complications related to the feet, and this is probably going to be the final post just for a little bit that we'll discuss feet until we jump into something else. Today I wanted to cover two areas. Number one is going to be actually caring for your feet, and the second area is going to be caring for a dressing if you have a dressing on a wound on your foot. We mentioned previously complications in the diabetic foot can be nerve injury, it can be injury to the arterial circulation, it can be vein incompetence, it can be also deformities of the foot or toes, it can also present stiffness of the tendons, joint pain and arthritis as well, and therefore all of this can add up to added dysfunction of the foot and putting the foot at a higher risk of injury. So let's just go through. I'm going to have a simple way of thinking about your foot care. Okay, so we're going to think about the skin, the nails, and the footwear itself. So in every area, we're going to start off with what you do, how you check it first, and then how you take care of it. Okay, so remember with the skin, make sure that you're checking your skin every day. You're looking for any areas where there may be rashes, cracks, bruises, excessive dryness, excessive peeling, etc. When you wash your feet in the day, remember you're using water that's definitely not too hot. You may not want it too cold, but definitely not too hot, because persons with nerve injury can't tell if it's too hot, and also if the skin is fragile or vulnerable in some way, water that's too hot can actually cause damage to the skin. Okay, so you want to wash off with a gentle soapy water once you don't have an active wound or ulcer, and you don't want something that's too harsh or abrasive against the skin in terms of soap that's more like a detergent or too strong or anything like that. Okay, when you're drying the skin, you're going to pat it dry gently with maybe like a nice towel, and you also want to just dry gently in between the toes. So you don't want to rub between the toes, you just want to dry gently in between the toes. Okay, and then you're going to moisturize. When you're moisturizing, you moisturize your whole foot, from your ankle over the top of your foot, over the toes, under the toes, the sole of the foot, the heel, which often is the driest part, and back up to the back of the ankle. Of course you're going to do your legs. I'm just telling you about the feet because we find that a lot of people don't moisturize the areas around the toes or on the bottom of the foot. Now, what part of the foot did I miss moisturizing? Between the toes. We generally do not moisturize between the toes because excessive moisture increases the risk of fungus. Okay, and so this is how you take care of your skin. For some people, a nice gentle massage might be helpful as well, especially if there are circulation issues or if you have nerve injury. Massage has been shown to be a benefit for sure. Okay, and you want to make sure you're covering that lovely skin that you've prepared with a nice pair of socks that doesn't have seams, that's not too thick. One exception to the care of the skin obviously is if you have vein disease and you wear compression socks or stockings, you may have this routine at night versus in the morning, because you don't generally put stockings over legs that are creamed, because sometimes it can make them kind of slip and slide and can cause problems. Okay, but of course discuss this with your healthcare provider. So I've gone through the skin. Also with the skin is thinking about looking in between the toes. I didn't mention that part. Looking for fungus in between the toes or on the bottom of the toes, sometimes where you may get cracks. So let's go on to the nails now. So care of your nails. We mentioned the care of the nails kind of in talking about the skin, whereby you moisturize right over. But let's think about the nails. So when you have to deal with your nails, provided you don't have an at-risk foot, meaning you don't have nerve injury, you don't have a circulation issue, you can clip the nails or clip straight across. You don't clip them all the way back to what people call, I guess, the quick. You're going to clip them straight across, and then you're going to use an emery board and you're going to put a gentle file on them just to rub them down a little bit. I always tell people don't clip all the way back, because sometimes people actually come in and they've actually cut themselves, and some people don't even realize they've cut themselves if they have nerve injury. Don't go digging up in the corners. If you have an ingrown nail, you might want some advice as to how to deal with that to reduce the amount of ingrowing without actually cutting way up in the corner or digging in the corner yourself where risk of putting yourself at an infection. Okay, so that's basically care of the nails. If you have to use an antifungal solution for the nails, that mostly is going to be prescribed twice a day. If your nails are very brittle, sometimes it might just be prescribed once a day. And if you're using an antifungal nail lacquer, that usually is just once a day, not twice a day. Some people use creams if they don't have an alternative. I generally do not prefer creams just because sometimes they can make the nails overly kind of, I would say, damp or macerated, that type of thing. If you do have to use a cream because you don't have a solution or a lacquer, you want to make sure that you're using a very teeny amount of it to treat fungus. Okay, so that is generally the care of the nails.
Thank you, Dr. D, Dr. Diane Braffett, for all those tips on how we can take care of our feet and our nails as we move into our Saturday song of the day. And you would have heard the sad news of Ernie Smith passing away recently, so we are going to play a song in remembrance to him. This is All for Jesus. Compliments the Maria Holder Diabetes Center and Republic Bank.
Jesus, come today for a poor man like me. Salvation come my way, my soul set free.
The Maria Holder Diabetes Center.
Jesus, come for all, and we must hear his call. Open up your heart today and let it be. No matter if you're thief, or if you're dread, or if you have a crown on your head, no matter if you have no heart at all, Jesus bring love for one and all. Sing your children, I for Jesus, you for Jesus, all for Jesus, fall for Jesus. Come to Jesus, Jesus come for one, he come for all.
The Maria Holder Diabetes Center.
Cheryl, share with us your experience of the challenge of living with diabetes.
It has been very challenging because I had developed diabetic neuropathy in my feet. That was a challenge, and I was recommended to attend the Diabetic Center at Warren's, and that was the best decision that I could have made. They gave good advice and treatment, and I like the fact that they have a complete team, a range of medical assistance for diabetics, such as your eyes, your heart, and your general health. And they're very professional. I'm saying that diabetes is not a death sentence. It's challenging, but you can manage it, you can live with it. You need to be disciplined. And also make sure, if you're listening to the program this morning and you haven't already gone, please visit the Diabetic Center at Warren's. There's a great team there. They give you advice, they guide you through, and you'll be much better for it.
Cutting-edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Managing diabetes means treating the whole patient, not just blood sugar.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. But members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
The Maria Holder Diabetes Center.